Good afternoon and welcome to St. Thomas More. I'm delighted that you're here. Healthcare has been in our national news for a very long time, and it's a very confusing topic and one that we were hoping to try to unpack and open a discussion about. The undergrad council, grad council, and program committee have worked very hard in organizing this afternoon. I thank them for their interest and support. I'm going to turn it over to Dr. Jack Hughes, who will be our moderator, and he will introduce our panelists. Dr. Hughes is a graduate of University of North Carolina, Chapel Hill, and the University of North Carolina School of Medicine. He's currently a professor at Yale School of Medicine, where he has received several awards from medical students and medical residents for excellence in teaching. He was involved in the development of the original diagnosis-related groups that were introduced by U.S. Medicare for hospital reimbursement in 1983. He has consulted with 3M Health Information Systems for several years and participated in the development of clinical risk groups, a patient classification method for capitalization-based payment systems, and more recently helped develop potentially preventable complications, a screening tool for in-hospital complications, and potentially preventable readmissions for comparing rates of repeat hospitalizations. His academic interests include the evaluation and comparisons of risk adjustment mechanisms, healthcare finance, and cost containment strategies. Please help me in welcoming our moderator, Dr. Jack Hughes.
Thank you, Mike. Just to introduce our panelists, and I will also provide a brief overview of the recent health reform legislation. And I'll start by introducing Dr. Tilio Granata. He's Associate Clinical Professor of Medicine at Yale School of Medicine. He has done consulting work to numerous organizations. He's a graduate of Yale University, Yale School of Medicine. He did his residency in internal medicine at Stanford University, and then an MBA at the Wharton School. He returned to New Haven, where he has been a stalwart in our teaching programs, both at the public health school and in the medical school. He has interests in medical policy and technology, is an avid teacher and well-respected by students and faculty alike. Ms. Patricia Dillon is state representative from the Westville section. She's my state representative. She is a graduate of St. Mary's High School in Manhasset, New York, graduate of Marymount College. She's a graduate of the Yale School of Public Health. She's been in the state legislature for many years. She has served on the Appropriations, Judiciary, and Higher Education committees. She was the first director of the New Haven Project for Battered Women. She has been both on the Finance Committee and the Appropriations Committee. She, at one time, was chair of the Public Health Committee. She has a degree in public health from the Yale School of Epidemiology and Public Health. Her thesis was on AIDS and the blood supply. She has a continuing interest in health issues, and public health issues. And next, Dr. Peter Ellis. Dr. Ellis is a graduate of Princeton University, the Robert Wood Johnson Medical School, and did his residency in medicine at Johns Hopkins. He then was he did his residency. There'll be a quiz on this. I've already flunked. He did his fellowship at Hopkins, and then returned to New Haven to be on the faculty at Yale, where he says he is tired of roaming through the Northeast. He has been at the primary care program at Waterbury, and now is on the faculty here. And while in Waterbury, started Project Access and helped to recruit over 300 physicians and over $3 million in donated care for those without medical care. And he is now the director of the primary care clerkship for fourth-year medical students. So if you folks will come join me up front here. trust you with part of your income.
Maybe you remember the baby came?
But they have those screws on it. All right, before I turn it over to our panelists, I want to just say a few words about the healthcare reform legislation, which so recently passed. It does a number of fairly impressive things, and to many it is the dream long deferred. To many it is the government takeover of healthcare. For many people for whom the dream was too long deferred, it was not enough of a government takeover of healthcare. But it does many things. It greatly expands access to health care. It reduces the number of uninsured in this country, projected to reduce the number of uninsured from 53 million down to 23 million. It provides a mechanism for subsidizing health insurance. It expands Medicaid. It provides exchanges for the purchase of health insurance policies that will be subsidized by the government. It introduces a number of organizational changes. It greatly changes the practice and the sale of health insurance in this country, with many provisions that will actually start right away. And that includes a prohibition on rejecting applications for insurance for pre-existing conditions. It prohibits rescissions, whereby insurance companies could simply rescind a health insurance policy once someone's costs were considered to be too high. There will no longer be lifetime limits or annual limits on health care spending by insurance companies. Health insurance companies will be required to spend at least 80% of the money they take in on medical services. So this is a very substantial change. It creates, it's anticipated to cost about $960 billion over the next 10 years. It actually generates revenues through new taxes and fees and through cuts in projected spending of over $1 billion, with the excess being directed to reducing the deficit. So it provides a very substantial set of changes to the healthcare system. The thing that remains to be seen is how well this new system will contain costs. And this is something, there is much work left to be done. This is, to many of us, a wonderful start, but there remains a great deal of opposition, and there remains a great deal to be done in terms of how this legislation is implemented and how costs are contained. So, having said all that, I will ask each of our panelists to speak. And I think, Peter, you were going to go first. This is Dr. Peter Ellis.
Right. Can, Justice, can everybody hear me? Okay. Too loud? Too soft? Great. Need to watch here. Well, it's an honor to be invited here today as a fellow community member and as a practicing physician. I work in New Haven. I have my own practice, and it's quite busy practice, so I'm fortunate to make it here in time today. I'm going to try to do three quick things. One is share two real-life stories that I hope illustrate the benefits and the hazards of having and not having health insurance. Second is just briefly allude to the difference between health insurance reform and health delivery reform. This legislation does a lot in the health insurance, doesn't do as much in health delivery, which to me is the holy grail. But I'm delighted we've passed what we have. And third is to describe a little bit more about Project Access, which we're starting in New Haven in June of this year. I brought several handouts for folks that are outside. The tome of the health delivery is 2,000 pages, and I didn't read it. It's very confusing to me, so there's some frequently asked questions there, and there's a